Welcome to episode 1 in our series COVID-19 101.
Today we'll be talking about masks.
As you can see, we're filming this from home in sweatpants. Seems to be the official COVID-19 uniform.
Probably true.
Yeah. So as you can see, we're not sitting 6 feet apart, and that's because we've been living together since before the pandemic broke out, before all the quarantine regulations were put into place. And I think we've become quite the quarantine.
So there's been a lot of confusion about whether or not you should be wearing a mask when you leave your house, and those recommendations have also changed over time, and we're going to try to clear this up a little bit for you. At the beginning of the pandemic, the CDC did not recommend for people to wear a mask when they leave their house, and they recently changed that, and that has a lot to do with what we've learned about the virus. We've actually found out that a significant portion of COVID-19 patients don't develop any symptoms at all. That's what we call asymptomatic. And then there's another term that you might have heard, pre-symptomatic. Those are patients that are infected already with the virus but don't show symptoms yet. And that phase could actually take up to 14 days. Both of the groups that I just described could easily be spreading the virus without knowing. This is especially dangerous when you're in places where social distancing is not really so easily maintained. Imagine you're in a grocery store and you really have to stay 6 feet away from everyone else. I don't think that's possible.
So this is where masks come into play. The CDC now recommends to wear a cloth face covering.
Hard to say.
Not a mask. And this is because there is a shortage of masks. Surgical masks, N95 masks. These are personal protective equipment for nurses, doctors, people on the front line, in the hospitals, in the ERs, treating COVID-19 patients. So let's talk a little bit about what these face coverings should look like.
Sure. So, they should fit snugly against the side of your face and be secured behind your ears, and obviously you'll want them to cover your nose and your mouth. They should have multiple layers and still allow for you to breathe. Duh. Use a fabric that you can machine wash and dry often. And guess what? That's actually enough for cleaning your homemade mask in between uses.
The CDC website has instructions on how to make a mask at home. It's very simple. You just take a t-shirt or some old cloth that you have laying around, and you don't even need to know how to sew, which is great because I certainly don't know how to sew.
Nor do I.
So we'll link the instructions in the description box. We were even really curious about how this no-sew magical mask would work, so we tried it out at home for you. Check it out. So here's the final product. It's not very aesthetically pleasing, but it is practical. How do you wear this thing?
So the first and most important step is to wash your hands with soap and water. If that's not possible, use some hand sanitizer.
Okay, let's get this rodeo started.
Okay, so put on the mask and make sure it covers nose and mouth. I know it's really hard, but it's crucial to not touch the mask or your face while you're wearing it. So what if you actually touch your face or the mask while you're wearing it? Very simple. Sanitize your hands or wash them if possible.
Alright, cool. So how do I take it off?
It's best to remove it from behind your ears without touching the front of it. Do you need help?
No.
Always, and I can't repeat this enough times, wash your hands with soap after removing the mask.
So you might be offered a surgical mask like this at a hospital or doctor's office. So in order to wear this, you first have to figure out which side is the front and which side is the back. After you do that, put it on your face and pinch this metal wire on the top so that it fits snugly on your nose. These are single-use masks, so once you're done, just throw it away. So then, should everyone be wearing a mask?
Almost. There are a few important exceptions. Don't put a mask on children under the age of 2. Don't put a mask on anyone who has trouble breathing or is unconscious or wouldn't be able to remove the mask themselves.
Thanks guys, that's all we have for you today. Check the CDC website for further instruction and information to help keep yourself safe and everyone else safe during this pandemic.
This is the first episode of an education campaign by the Rutgers Global Health Student Council. Stay tuned for more content in the next few days.
Submit any questions you have in the comments below. We will try to address them in the coming videos. Stay safe.
Stay healthy.
And we'll see you next time. That's great. This is where the bloopers come. Yeah, well, wait, do I look fat? Alright.
So, the very first thing, and it's really the most important step, is to wash your hands with soap and water.
Oops.